Claude Pierre, asking, was there a correlation between resolution of enthesitis and ACR20 or ACR50 response?
So no correlations were done formally, but the response was reported in a publication of the whole study that actually shows very nice tracking of the responses of the joint and enthesitis domains. What was different in this study was the skin response. So secukinumab actually had a higher skin response than the adalimumab group, but otherwise the ACR20 responses tracked pretty similarly in both groups and seem to track similarly to enthesitis response.
Okay, yeah. Then another question of Dr. Chandran, more a remark, I would say. Should you not say clinical enthesitis rather than true enthesial inflammation?
Thank you for the very interesting question. So I think we're limited with the established outcome tools. So the established outcome tools depend on tenderness listed at enthesial sites. And of course, many of you know that I'm an imager, so interested in ultrasound. So there's a whole body of work showing that clinical examination does not reflect underlying structural changes and also mild inflammatory changes. So this is problematic, but these are established outcome tools for measurement of enthesitis.
Yeah. I was wondering also, there was no, in the study, imaging included to confirm enthesitis?
Not in the study, no.
No, okay, yes. And then I thought you have one question in the chat. What about patient-reported outcome measures? Where this result is seen for adalimumab and secukinumab?
So on this poster, we formally reported the HAC-DI responses. The other patient-reported outcomes were done in the EXCEED study and are reported separately.
Okay, then we can refer to that. Maybe I had one more question myself. Were there any differences in response between secukinumab and adalimumab depending on the location of the enthesitis? For example, heel enthesitis, Achilles tendon, plantar fascia versus other locations?
So this substratification response has been looked at, and this data has been actually submitted to the American College of Rheumatology as an abstract. So look forward to presenting that work if it's accepted at a later date. So we definitely looked at this sub-analysis.
So, okay, then we're looking forward to that. And then another remark in the chat, do you think that women really have more often real enthesitis? Or is there maybe, I think the question is also, is there maybe a component of fibromyalgia or hypersensitization that's involved here?
Yeah, these are excellent questions. So as we all know that males with psoriasis and those with the higher body mass index have higher severity. But in this study, it turned out females reported more pain, and one of the questions is this a confounder? And I think this will be one of the interesting questions that we will dig through in the patient-reported outcomes and look at the measures of fibromyalgia, etc., to see if these correlated to the higher scores in the females versus males. But obviously, this is one opportunity where in future trials, imaging would be useful as a more neutral arbiter to figure out what exactly is going on and what is responding.
Yeah, very much true, I think. And then in the chat, a question, in patients with a higher number of affected entheses, SPARC score higher than 6, there were numerical differences of adalimumab over secukinumab. Was this difference found to be statistically significant, or how could we interpret this?
No, the confidence intervals are overlapping. So, and plus, by the time you get to the subgroup analysis, the numbers are small. So we can't really make big conclusions based on statistical analysis. Because of power testing, number of people are smaller. So I think what we can say is they're similar because of the overlapping confidence intervals.
Yeah, so no statistical significant differences, but maybe interpreted with caution given the smaller sample size probably. Yeah. Okay, And then a question in the Q&A. Would you comment on the randomized ultrasound study with secukinumab? Is there not one?
That will be actually summarized later by Dr. Boris. So the study is coming up, the ultimate study.
Okay, then we will wait for that. Okay, then I hand it over to Lieslot again for the next presentation.